UK Healthcare Community Connection is sponsored by UK Healthcare.
We have Dr. Tukea Talbert with us on the couch. You are the Chief Diversity Officer at UK Healthcare.
Yes, and
Thank you for being here.
Start off, if you would, Doctor, by telling us a little bit about what diversity, equity, and inclusion mean at UK Healthcare.
Okay, so thank you. First of all, I love being here with you this morning. So first of all, at UK, what does it mean? It means that it's interwoven and intertwined into everything that we do. So it's about our everyday decision making and how we think about things and how it impacts all of our people. So that's our workforce, that's our patients. But more importantly, I like to refer to the DEI strategic plan as the power of three. So it's about our people, which is our workforce, that's our staff, our faculty, our learners. It's about the patients that we serve every day all over our enterprise. And lastly, it's about the purpose, and that purpose is ensuring that both those people and the patients have a fair opportunity to be wildly successful professionally and personally, and that patients reach their highest health outcomes.
And we know that that's such an important mission. What programs does UK have in place to support diversity, equity, and inclusion?
Okay, and it's important when we think about diversity, equity, and inclusion that while they're all interrelated, they're all different. So some of the programs that we have, and this is not an exhaustive list, one of the things that we believe that's very important is representation at the bedside. And patients like to see people who look like them. So how do we set that tone? We've had a very specific program around administrative fellowships where we focus on having a very diverse candidate pool, which increases the likelihood of us hiring people that are of diverse backgrounds and top talent. So we're very intentional with that action because, again, you set the tone at the top and hopefully that transcends to the bedside. And probably the other big thing that we're doing is the measurement of impact. You know, we can talk about diversity, equity, and inclusion and what we're doing for health equity and for the patient, but we are really looking at creative ways to look at our data and how we analyze data and patient outcomes so that we can be more specific and focused on patients and populations at risk and have programs planned around meeting their needs.
Tight on time here, Doctor, but before we get out of here, tell us about this program, Search. What is that about?
Yes, Project Search. We love it. Project Search is a great program. It is really a program that we're looking at individuals in the community with intellectual or developmental disabilities, and we're looking at a career path for those individuals. So it's a recruitment pathway. And so it's really exciting because we call it the pathway of possibilities. And so not only does UK want to be the place where patients want to come, we want to be the employer of choice. So we've created a specific plan around individuals in that identity or with disabilities to be a hub where they can train for competitive employment.
Brilliant. It's a great strategy.
That is awesome.
Thank you for being here with us. I appreciate your mission, and I know you're doing great work over there. Thank you.
Thank you.
We'll be right back.